In a rural area, we have difficulty because we don't have access to providers that you would have in a metropolitan area. So having additional resources that are provided by CHS kind of extends our ability to get patients help. CHS is a partner with us, and they provide two things. One is the data analytics piece. They also provide staff to help with patients who need social services, and also to help our staff understand how to manage the patient when they're here for treatment.
Being part of this ACO, I do feel that I can make a choice of any provider that I want. Patients who have choices are going to be more compliant with the decisions that are ultimately made about their health care.
The benefits that our patients have as a result of the relationship that we have with CHS and our participation in ACO is looking at quality outcomes.
One of the things technology has brought is different programs that make it easier for patients to stay connected to their healthcare provider.
I think telehealth is most valuable for our elderly, our Medicare patients, who in this rural area, sometimes it's difficult to get out because of the weather. Sometimes it's difficult to get out because it's just difficult.
And especially in the rural area where it can be quite a drive to get to the clinic to ask some of the more basic questions and still get to see your provider via telehealth. It's a great option.
We have a large number of patients who suffer from diabetes, hypertension, and other chronic conditions. I think our relationship with the ACO has been very valuable in helping us focus on those patients.
I get the annual wellness visit because I think it's really important. I actually had the experience of catching some pre-diabetic numbers for me and was able to look at my diet and make some changes that brought those under control, which is so important to catch that early and do the preventative rather than having the experience of waiting and now we're having to treat diabetes.
All patients who suffer from diabetes have common support that they need. And the ACO has helped us to identify that. And so we've provided better care as a result.
I'll suggest to friends, you ought to try Georgia Mountains Health. It's because I know the quality of care that they are going to receive when they come here.
I have experience in the for-profit and nonprofit healthcare world, and this practice has been most rewarding as a nonprofit because of the outcomes that we provide to patients and because of the quality of care that we deliver. And we do it in a way that's cost-effective.